So here's where I want to spend a bunch of time, because you spend so much time here, and this is where the big payoff is. So you've done all this, you've done this deep dive, you've done all this planning, and now we're getting ready to migrate workloads. And at first, migrating the workloads goes a little slow, but then it really picks up pace because you're just doing the same thing over and over again. So give us an idea of some of the things you think about going into migrating to the cloud, and some of the processes that you take a look at.
Well, first and foremost, if we're doing lift and shift migrations, the easiest way to do it that we always found is to do a disaster recovery failover. Right? So we create the disaster instance in the cloud, which allows us to create a full production snapshot, everything we need to build the skill, build the confidence, build the expertise for it, and then go through a few iterations of failover without impacting the business. So in those cycles, now we've built everything that we need to at a low price point, at a low impact to the production environment, and got the business to buy in and sign off on it and build our total confidence. And that's kind of probably the primary way that we start the process, because it allows us to kick the tires, allows us to build the confidence and build the models that we're going to need for the full-scale migrations.
Yeah, you really encourage people to start with the easy stuff first, because your team is learning a new skill. So you don't want to start with, hey, let's start with PAX. you want to start with something that's pretty small, pretty self-contained, not a complex architecture, and your team's just getting that, building up those skills. And then as you sort of move down the road, then you start doing some of the more challenging, more difficult migrations. But I want to go back to something you said. So you start by standing up a DR environment or a greenfield environment that you can fail over to. That really is one of the secrets that you brought to the process that kept our downtime pretty minimal in this migration process. I mean, because when you can fail over from one to the other and just sort of switch those users over, now you're not looking at extended downtimes. And plus, in the process, you're building out DR capabilities for each of these applications as you move forward. So does that work for all the applications, or just a certain set of those applications?
In a large portion of them, it does, right? And I would qualify that to say a large portion of them is transparent, right? The user experience is barely a blip on the radar for them. There are some that struggle with that, but architecturally, you identify them way before.
Yeah. And so I think the other thing which you drove home, you and David both drove home to me, was this migration process is more of a people and culture challenge than a technical challenge. Obviously, we're bringing our IT staff along. We're training them as we go. But also, you guys built up a pretty solid team with Rachel and the rest of the team, and Rachel, who we've hired at Health Lyrics now, who put together great processes for engaging the end user community. So they engaged them early in the process, walked them through it, talked about the benefits. So that team became really good after you do a couple hundred applications. They actually ended up with an extensive database of everyone in the organization. They knew who the key decision makers were. They were able to engage them at every point within that, and they became a trusted source for that. So do you still see that as a pretty critical team to have in place for this migration?
Oh yeah, absolutely. It's not worth doing if you don't understand your business and if you're not talking with them, right? Because they're going to define their tolerances. They're going to define their appetites. They're going to tell you, don't bother me these days, but I'm okay these days, which gives you your operating models to build your confidence for them. And there are so many other problems that you find that exist outside normal IT that you win a lot of goodwill just by solving easier problems too. So building that relationship back and forth is absolutely critical.
Yeah, some of the not necessarily seen benefits for us were, I think we got rid of 10% of the applications just by talking to people, just by going out there and saying, hey, we're going to be migrating this application. You're listed as the owner, and they looked at you like, yeah, we don't use that application anymore. You're like, great. And so we didn't know we were doing an application rationalization project, an app wrap project, but we ended up archiving a whole bunch of data and a whole bunch of applications just in the process. Because as you pointed out earlier, a lot of healthcare just grew over time of, we added this application, we acquired this company, we never really cleaned all this stuff up. And this is a great opportunity to do that. So we get 24 months later. Here are some of the things, we never did spend that $15 million on data center improvements because we didn't need to. We went from server provisioning and people find this hard to believe, but really from 2 to 3 weeks to provision a new server with the processes that we had, to almost 2 to 5 minutes to provision a new server. And sometimes our clients find that hard to believe, but to be honest with you, with a credit card right now, I could go online and provision 100 servers in the next 10 minutes on AWS, and I don't even have the requisite stuff lined up yet. So that's the kind of stuff that's available in the cloud. And then the other thing is we got access to a whole bunch of new capabilities. You created the ability to fail over regionally and some other things.